Just before presenting our final speaker, I'd like to share with you a short video interview we had with Maribel Adame Valero, who unfortunately could not join us tonight, but was originally one of the speakers. So Maribel is a senior community manager and global global leadership fellow at the World Economic Forum, and she will present entrepreneurship and technology in the global public interest, specifically at the service of health.
My name is Maribel Adame.
Sorry.
I work My name is Maribel Adame. I work for the World Economic Forum at the Global Health at the Forum. I have a background in telecommunications engineering. Soon after I finished my graduate studies, I specialized on medical imaging. I did a PhD at the University of Leiden in the Netherlands, and that was when I realized how much I liked the technology to the use of healthcare and the service of patients in general through advances in innovation, but also helping with information and knowledge. Something that is really coming up now is the use of mobile technology for health. This is something that is especially important in Africa, where you don't have the physical infrastructure. So this is helping a lot to improve the access to healthcare, and not only the access to treatments, but also information for patients. They have developed different systems where you can have standardized text messages that you send to your healthcare center and ask for advice on how to take different medicines, but not only that, also to check the validity of those medicines and avoid black market and so on. So that's another aspect of technology that is improving a lot. We can also talk about the use of internet and how that makes it very easy to share information, especially with those people that need it most. We are seeing that there is an increase in non-communicable diseases, and by that I mean cancer, obesity, pulmonary diseases, cardiovascular diseases, and most of them are really preventable. So if people know a little bit more about how the ideal lifestyle should be, then they can also prevent many of those. There is a need also for the patient to be empowered, to be able to make decisions. A patient that is better informed will also be able to make decisions on which kind of choices they make in treatments. Maybe there are different possibilities with different side effects. At the moment, it's only the doctor that decides that for you. Maybe the patient also wants to be involved in that. How do you empower them? As we were talking about that before, information is key. If you don't have information, you cannot really make the choices. There are different programs, technology or for information exchange. We have the DICOM standards. However, those can be customized, and most vendors, most hospitals have customization, which makes it not so easy to exchange with other parties. This is something that people are very aware of, and in the last 5 years there has been a lot of work in that direction to try to unify the information units so that you can change information. That's more in the sense of how can we make use of the data that is available to better predict diseases, like evidence-based and so on, but also the information towards the patient. And there are a lot of platforms coming up by the internet, and how can you access easily the contact with your GP, maybe a kind of telemedicine, a teleconsultation. So those are very important aspects of the role of information in health. What we are seeing with mobile technology, especially in globalization, is the access, the worldwide access for all. And if you have access to information about news, everything that's happening in the world, why wouldn't you have access to information about your health? I think that for me, a global leader is someone that really takes into account everything that's happening in the world. Because we are really seeing now the interconnectedness of the world is showing that we cannot just think of locally. Everything is connected, and something that is happening on the other side of the world will affect us. So if you really want to give direction and lead, might be a company, government, or wherever, you really need to take into consideration everything that's happening, from geopolitics to economics, culture differences, migration. Global health is not just a matter of the healthcare sector. Global health is something that is affecting us all. Healthier workers are more productive. Everyone has to come together to join forces to work towards a healthier future.
This is what the world should look like. It doesn't.
Sorry. Thank you.
The world has issues, but there